Hi, me, McKinney, Miss Space Heater, um, and just a couple weeks ago, until Assembly for San Diego, La Jolla, same general area. Um, yeah, the hair is new, actually. It's definitely not mine, but it's proof that friends can act like family. Um, and for me, that's enough. There's another part of the family. He's an attention hog, but one that warms my feet sometimes so he can stay. And cuteness does have something to do with it. Anyhow, eh, to kind of update people on things, this will be uploaded to my YouTube, so it's easier to post that way, and it takes less time. It's paling it with my space heater. I think that's, well, um, and it's one of the hardest things for me because I don't ever get entirely what feels like warm. You feel cold and you feel burning at the same time. It's like you're a big block of ice that's on fire. Not that that would make sense to most people. But anyway, what I like, I think, about the approach in San Diego is that it's not just doing one thing at this. It's doing a lot of things. It's addressing autoimmune, because I kind of agree. Like many, but as I feel, if pain is inevitable, suffering, however, is optional. And I think, a distraction on music go only so far. Over medicating and putting yourself on a lot of psychiatric drugs, it's not an approach that I agree with, personally or professionally. But would I like to get back to a point of being an MP again? Yeah. But progression does what it does. And do I think some of the care provided put me here? Probably. But some of it was also very good. So in reality, I think it's a mixed bag. But I know there's been some discussion on the matter, and nobody needs to see the mess in here. Oops, sorry. Anyhow, I think it's... I've had enough of feeling like this. And I think a lot of the pharmaceuticals, they ruin your body. And my body's not doing so great. I think what's ironic is that I used to fight to lose every pound. And believe me, some of the medicines that I was on over the years, you wouldn't believe what they blew me up to. It's embarrassing. But it's another night of pain out of control. Maybe not as much. But you never know when that's going to happen again. And that's the part that I need to be able to ditch. I'm trying to study to get my certificate in medical insurance billing and coding. I want to stick it to the insurance companies for sucking at what they do. And I think this offers me the best chance of doing that. And, hopefully maybe working from my home and having a life outside of being constantly sick. Nobody likes living like that. That's the issue I have with that diagnosis of chronic pain syndrome. I think what it does is it makes chronic pain out to be a psychiatric illness, and it's not. And there's no reason to take if an antidepressant helps you sleep, on occasion when you can't. I think that's one thing. Um, because of, risks. I mean, it's a tough call, and it's one that you and your provider make. Um, but anyway, I think it's just being able to do day-to-day normal things without wanting to. Okay, if somebody's making the ceiling cave in, without wanting to. I feel like you need 25 hours of sleep to recover. Or if you take that 25 hours of sleep, you're paying for it with pain. I think the best gift that I was given by a provider, it was, and it was out of Seattle, believe it or not. And most people who know me know how I feel about that place. I can't stand it, most of it. The coffee was one thing I brought home to California with me. Once an addict to coffee, you will always be an addict to coffee, worse than cigarettes. But it was when she said to me, there's no question you have pain. Nobody's arguing with you. And that does more, I think, than people realize for somebody with chronic pain. And then I think that doing that is something that is so valuable, is acknowledging that and saying, yes, you're in pain, let's do something. Let's do whatever we can for you. I think doing just one thing, putting one medicine at it, I think that is an area where you call some polypharmacy into, which is multiple medications. And I don't mean throwing some Neurontin and some pain meds at it. They don't work. Not for me. There are some things that'll slow it, but it's not enough anymore. For a while, it was. And now that things have progressed and worsened from my surgery, and then an injured ankle, busted by somebody allowing a lead door to slam into my foot after x-raying it, and not x-raying it again. Okay, folks. But irregardless, accidents happen. I'm not sure the guy intended to do that. The hospital, however, I don't even want to get into that. But I think PTSD from chronic disease is a more fair way to diagnose than sticking a chronic pain syndrome. Because if you guys look that one up, you'll hate it as much as I do, as a patient and a provider. I would love to really do it ultimately. Here's what I really want to do. Get my naturopathic doctor, be able to write medical marijuana certificates in whatever legal state I choose to reside in, as long as they have some ketamine available for me, and the recommendations from scripts, I think were cool. And then sit for my ARNP boards and be able to write for anything I damn well please. And I can't always say it would be an opiate or weed or whatever you want to call it. If somebody's going to use this stuff intelligently, that's one thing. If you're going to use it to be stupid and get stoned, don't ask for my help. But I think using a scientific approach is the best way to go. Because then it's not getting stoned. And the reason I decided against doing infusions by themselves is because I do think this is autoimmune. But doing nothing about it didn't really seem like a good plan. It's expensive every month, But so is a grand per infusion and just co-pays and staying at the ketamine house by itself. And that's 40% of my annual income right now. Now, if I'm able to finish my certificate program, I hope that'll change. As will the neighborhood in which I live in currently. Which, with me, right now, it's cool. It beats the federal housing project, you guys. And I know some of us live in them. So I think, having a goal of feeling better, yeah, I'm tired of being sick all the time. It wouldn't be. To imply that people enjoy it somehow, and that it's a psychiatric illness, I can't agree with it. As patient or provider. But, regardless, I know there's some nights that you're not sure how much more you can take. Those are the nights that I cling to what I have and I pray. Because everybody has to have something to lean on. And it can't always be medicines or a doorknob or whatever. A furry friend helps, but I think during like this, what you can, knowledge, research, being responsible with medications and supplements and so forth, getting good quality recommendations, and a reliable source, I think is extremely important. I use med planners to make sure I don't turn into an addict, because that's not a place I would wish on anyone. And the idea scares me to death. And I think this really is the way to go. I mean, when you reach a point where you're willing to put what you have into a couple of suitcases and board a flight, I did learn that I'm never flying again. I can't. It worsened my CRPS. And it's caused a flare that hasn't quit since I landed. And I landed on the 23rd. Today is Valentine's Day. Anyway, may I wish you a happy heart day. And so far, a better day.